All right, well, welcome everyone to Administration Station. We're thrilled to have you guys back here. We have a great talk today from David Brody, who is the Deputy Executive Director of Cardiology and Cardiothoracic Surgery at Northwell. Very, very important services. So we're going to hear a little bit about him, his trajectory. I'm going to be monitoring the chat. So for this session, you can please feel free to shoot your questions as they come. And I'll be kind of cataloging them, and we'll make sure that there's adequate time at the end for a really good Q&A. David, I'm going to hand it over to you.
Great. Thank you, Rebecca. Can you hear me okay?
Yeah.
All right. Perfect. Well, thank you for having me, and hello to everybody who's on here today. Rebecca and I were chatting the other day, and she took the time to kind of just orient me to the program, tell me more about it, tell me a little bit about all of you. And it's quite impressive to see not only, of course, how many people, but how wide everyone's interests are. My understanding is very frequently the people on here are from all across the world. So it's really quite impressive. And I thank you for being part of it. I think people's commitment to programs like this, particularly after something like COVID, where, we were doing a lot of in-person internships and experiences, and the fact that we had to pivot and you all had to pivot to do it a little bit differently, I think speaks to your commitment. And it's so great that you all are participating in something like this. And I'm going to spend a few minutes of my talk today talking about internships and how important I believe they are. So when Rebecca was sort of, filling me in on this, and we were going through sort of what would be best to discuss and what I would want to cover, it was a little bit of a mix of, I'm going to talk about healthcare administration in general and what I do and sort of the path that led me here. And then I'll probably just throughout that talk, just little things about general career advice and what I would be thinking about as a young person sort of preparing to do, whatever it is you're going to do for the rest of your life. So I'll go through that. Please try and be interactive through the chat. Rebecca, feel free to interrupt me throughout. And I'm looking forward to it. So for me, so I'm what I would call a healthcare administrator. I today as the Deputy Executive Director for Cardiology and Cardiothoracic Surgery at Northwell Health, and sort of I'm the lead administrator for those two services across our entire enterprise. And I partner very closely with the physician leaders for those areas. And, we call that sort of a dyad structure, when it's you and one other person sort of collectively setting a vision and carrying out a vision. So I sort of do that in cardiology, and I also do that in cardiothoracic surgery, both with some very, very, very extraordinarily talented clinical leaders. And I with them, help drive the clinical strategy, the development of our clinical programs, ultimately trying to grow our market share, right? See to it that Northwell is growing within our market, how much of the cardiology and cardiothoracic services we provide. Most importantly, we're responsible for setting clinical standards and driving quality. And we're also very involved in research and academics and the teaching of our residents and our fellows. So it's really everything under the sun. And how I most simply describe my role is it's my job to support our clinicians in carrying out that mission. And that comes in many, many shapes and sizes. And I'll go through that in a little bit. But backing up, I want to spend just a few minutes talking about kind of, what got me into healthcare administration. My understanding is that many of the people on here today are interested in clinical careers. And for many people who get into the healthcare administration side of things, for them, it started as, I wanted to be a doctor, I wanted to be a nurse, I wanted to be a PA or a nurse practitioner, whatever it may be. And either your interests shift, or you decide I still want to be in the field, but I want to do something different. For some, it's just it didn't work out. It could be a real smattering of reasons, but so some of you may find this interesting. And then for others, and I was not one, I did not want to be a physician, although the thought, crossed my mind from time to time. I did not sort of pivot into this after deciding I didn't want to do that for one reason or another. So for me, it started all about, it was a penchant for public service. In high school, I volunteered with my local fire department doing EMS. So I volunteered at the time on an ambulance as an EMT, which was an incredible experience. And it was there where I really just developed that passion for public service. I truly enjoyed helping people. I truly saw myself one day spending my career in the public sphere, whether that was something like in emergency services, or if it was going to be government, or if it was going to be in the not-for-profit area. But mission became really important to me, and I quickly saw that you have to do something that motivates you and something that drives you. And for all the other things that shape sort of how you make your career decisions, I think you could figure out different things to accomplish that box. But if you don't really enjoy it, it's gonna be a difficult run. And I think there are a few other things along the way that help shape that for me, which I'll get into. So that's really where it began, and that planted a seed. And then throughout college, I really had no idea what I wanted to do, and I kept coming back to this concept of public service, but with no real ironclad thought about where I would take that and what I would do. Which leads me to, I think, one really important point, which is you got to try a bunch of different stuff. And that could either be, in my case, I did a ton of different internships to be able to get a broad experience and a broad exposure to the many different things that I could potentially do. But even for you all, if you're really adamant about becoming physicians or going into medicine, I think within that, it's also important to really, really, really get a broad flavor for what it is you could do within that area. Whether it's different specialties, which all come with their own dynamics, right? Different interactions, different relationships with the patients, different quality of life, different sort of day-to-day activities. I think it's really important to start to feel out those different experiences. And I think it's just as important to learn about what you don't like as what you do like. And I think you shouldn't get discouraged when you experience something that might not have been a great experience. I think it's okay to have bad experiences along the way. And I think all of those data points help ultimately inform what it is you're going to do, and hopefully, help you make a better decision all along the way. So I did a number of different internships, banking and private equity, marketing, law. And it wasn't until I did one in hospital administration that I was like, eureka, I figured it out. It was perfect. I was able to blend all of my interests together in a very specific field, which very much had a tie back to that mission and that public service, which was so important and so passionate for me. It was incredible to me that I was able to, as an intern in hospital administration, work on a number of things every single day within a hospital amongst clinicians, working on things that really, really, really do impact what goes on in the hospital system and how you take care of patients. And that's not to glorify it, right? Not every single day is every single task I'm doing directly impacting what patients do. But when you really tie it all back, everything that we do here, particularly at Northwell, in the sort of administrative side of things, is about improving the environment for our patients or for our caregivers so that they can do better for their patients. And whether it's important strategic and business initiatives, whether it's quality projects, whether it's patient experience type things, whether it's even what we do for our employees to try and make their experience here better. All of that is ultimately so we can deliver better care to more people. And it was incredible. And it was able, again, with that as the foundation, was able to pique my interest in business and in finance and in strategy. And it's just really, it's been so rewarding. And I'll continue to speak more about that. But once again, that first lesson of spend as much time as you possibly can just gathering data points and figuring out what you like and what you don't like, which is why experiences like this, what you're doing today, and it's so great that you all are doing that, is so important. I've understood that over the course of the summer, you've been able to hear from many different people and learn about many different things related to both the clinical delivery of medicine as well as sort of the non-clinical aspects of it. So I think keep doing that. So healthcare administration in general, so sort of I'll get into the next portion of what I want to go through, which is really just to raise awareness, really not just around what I do, but I think there's a lot of other things that you can do in this field. So for starters, I think most commonly, which is where I would consider myself, is in the healthcare delivery side of things, right? Making sure that people in society have access to good healthcare, and then being responsible for actually, giving or delivering that healthcare. And there's so many different things you can do, particularly in large integrated healthcare systems. We often speak about it. Your interests can be virtually anything, and you could choose to do that in a large healthcare system. So whether you want to be a very traditional healthcare administrator, which is what I would consider myself, if you're a lawyer, if you're an architect, if you're a chef, if you're a government regulations expert, if you're really passionate about public policy, you name it, we have it here. I mean, we have hairdressers, right? We have people who walk around the hospital all day and cut hair for people, for patients. And that's obviously different than doing it in a barbershop or a hair salon. But again, tying it back to how important is mission to you, and what do you want to be doing? And when you go home every day, what do you want to feel like you've accomplished? So again, there is not a single profession that I can think of that we don't do here at a place like Northwell, where we have 75,000 employees. So I think that's broad, but as it relates to being a healthcare administrator, that also comes in many shapes and sizes. And I in my role, am a bit of a generalist, but we have people who get very focused on specific tasks. But how I break it down at a high level is I look at, there's probably 5 or so major domains which you're responsible for when you're a healthcare administrator. So first and foremost, there's the quality of the care that's being delivered. Secondly, there's the experience that the patient and the customer and the visitors and the families are experiencing. And that's the second one. The third is of course the financial performance and the volume and how much business we're doing. Because as much as we're a not-for-profit healthcare system, we generate probably about $12.5 billion a year in revenue in this health system. And the reason we're so keenly focused on our financial performance is because in a not-for-profit healthcare system, generating income is what allows us to ultimately fund our mission and fund what we do. We don't have shareholders, so at the end of the year, whatever's money is left over doesn't get redistributed to people and into their pockets. It goes back into the organization, and that's what allows us to build new buildings and buy new equipment and fund our research endeavors and our clinical trials and really advance the field of medicine. And that is all reliant on, again, generating healthy income. And hospitals and healthcare systems that make more money are able to do more of those things, and hospitals and health systems which make less money can do fewer of those things. And that is not good for the healthcare system, locally and across the country. So quality, patient experience, financial performance. There's the people aspect of it. I manage a very large team of people. It's probably about, when you add it all up, around 1,300 or so people across the entire Northwell geography. And then, within that, it's probably about 300 physicians who I work closely with, making sure that they, not only that you're a strong leader who empowers and motivates them to help advance the mission, but again, and I mentioned this earlier in the talk, are they enjoying and having a good experience as employees of Northwell Health? And there's been a lot of evidence that supports that the more engaged and the more happy your workforce is, the better they're going to be at their jobs. So a huge component of what I do as a healthcare administrator and as a leader in healthcare is focusing on empowering and motivating the people who we work with. Again, so in turn, they could do the best job that they can for our patients and for each other. And that's hugely important. And then and then lastly, I'll just kind of broadly for me put it in the strategy bucket. Healthcare, despite being a very altruistic field, is a competitive one. And us and our local competition around here, Cornell and NYU and Mount Sinai and some others, we're very much all competing with one another, and it's mostly healthy competition, and we're all ultimately, I think, driving each other to be the best version of ourselves, and that in turn is better for the patients. So when you take that all into account as a generalist, I every year have goals in each one of those areas, and what I'm trying to do, working very closely with my physician partners, is push that forward and get that agenda moving in the right direction, and making sure that we're making progressive enhancements every single year. Now, then within that, there's so many, as I mentioned, specialists, and I have people on my team who are very focused on specific components of that. And across Northwell, we have people who are focused on very specific components of that. So if the numbers thing speaks more to you, we have very specific roles for that. If the quality piece does, if the patient experience does, if the strategy piece does, whatever your interests are, there's an opportunity to really specialize within that. And in my various roles, I've had opportunity to specialize in a couple of those things. And then in my last few roles, as I've continued to grow professionally, I've been able to become more of a generalist and sort of like a business owner, right? Like, I really am responsible for this large entity along with my physician partners, and we're responsible for making sure all aspects of it progress. But then outside of that sort of healthcare delivery, there's healthcare consulting, there's public policy, there's the pharmaceutical end of things, and the device business and the technology business, and right, all the folks who are working in these various companies to invent things that are going to move healthcare forward. That's an entire bucket. There's, of course, public policy, which today is more important than ever, right? How do you make sure that within our government system that that the policy is set up in a way that is best for patients and for the national healthcare system? And it really goes on and on and on. But I have chosen to sort of focus my career and my work on the delivery end of it. And for me, one of the main reasons for that is what I mentioned in the beginning of the discussion, which is that for me, it's closest to the patients, and it's closest to the mission. And I walk throughout hospitals every day, and I really am able to see the direct impact of what I do and the effect that it has on patients and on providers. And that for me is extremely meaningful. But again, everyone's motivated differently. So I think reverting back to the first part of the discussion, spending as much time as you can today, having as many experiences as you can, that's going to help you understand what motivates you, what you're passionate about, and what you're going to figure out. And many people, and I'm still early in my career, but I think I have my interests pretty well understood and pretty well figured out. That being said, there's many people who all throughout their careers are making adjustments because their interests shift, or what motivates them shifts, or different things become important to you. Or there's some people who just also thrive off of doing different things. I was talking to a friend the other day who's looking to move into an entirely different industry, and not because she's particularly unhappy, but just because what motivates her is having different experiences. And I think we've also seen that the generational gaps that the different generations that exist today in the workforce, whether it's baby boomers or millennials, and I confuse them all with Gen Z or Gen X or whatever it might be, are all motivated by different things. And we know that the newer generations are very heavily motivated by experiences, in many cases above money and above other things that traditionally people might think motivate folks in the workforce. Experiences is very important to people. So I encourage you to experience and to help shape your way that way. So I'm gonna go a little. Rebecca, are we doing okay so far?
You're
Josh?
doing great. This is
Okay.
fantastic. There are also some great questions coming in that I'm cataloging. So
Okay. Are
well,
there any Are there any we should answer now, or should we hold them? I just want to, however you think this should best flow.
sure. Maybe we'll sprinkle a few in and then we can go back to the talk. Does that sound okay?
Yeah, that's perfect.
Awesome. Okay. Um, I know this is a challenging question for anyone to answer, but some folks want to know just what does your day-to-day schedule look like?
Yeah, great question. It's a little bit different every day, but so at this point, yeah, I have meetings virtually all day, and that's a lot of and when I tell you about a few of the other jobs I've had a lot of jobs where my day to day is about really producing a lot of work, being out and about, project managing things, doing analyses, putting together PowerPoints, really proactively meeting with people to get some ideas out of them and whatnot. At this point, a lot of my day is filled up with meetings, but that sounds awful, and sometimes it is, but I'm going to get into a little bit more specifics of what else goes into that and what types of things we're meeting about. But those meetings are with folks who are from across our network who ultimately we're trying to really make decisions. We're trying to develop ideas and we're trying to make decisions and we're trying to advance them. And so my day-to-day starts, with a lot of meetings as sort of the foundation, and that gives me a sense of what I'm going to do. In my specific role, I spend a lot of time getting around to our different operations and to our different sites. So for me, that's a number of hospitals across all of Northwell, and it's also a lot of our doctors' offices. And I go to those sites because that's where the people who I work with most closely physically are. And I think rather than me sitting in a central office, I like to get out and meet with people face to face. That's been a little challenged by COVID, but nevertheless, that's what we try and do. And then meeting with our corporate partners and with many of the people who are my stakeholders. And again, what we're trying to do is ultimately advance those domains that I discussed with earlier. But within those meetings, what we're trying to do is advance the strategy. We're trying to make decisions. But then invariably, every single day, there are acute issues that arise, and there are fires that have to be put out, and that usually ends up derailing most of my day and my calendar. And those issues can be everything from a sort of acute sort of thing that occurs in the operation, which requires sort of our intervening. Right. The other day, there was a massive water leak at one of our hospitals. And as a result of that, every patient who we had scheduled for that day at that particular hospital, which was countless procedural cardiology patients, a number of heart surgery patients, all had to be delayed. And the reason for that is the flood was so massive that they had to turn off the water flow to the building. They had to turn off the electric coming into the building because the water was seeping into areas where the electrical stuff was. And as a result, it wouldn't be prudent to start any procedures in that environment. Because that was happening, we were starting to think, okay, very quickly, what do we do with the patients who are expected to come in? Should we be proactively canceling some of them? Are there some who are, their clinical condition is acute enough that they need to get done today, and as a result, we need to move them to another campus and do it elsewhere? But then how do you work through that? The person who they've met, who they think are going to be doing their procedure, might not be the person who's going to be doing it. Or do we move the provider? So, in a moment's notice, within an hour or two, we need to make all these very important decisions that for us are commonplace, and it's everyday decision making and issues. But for you, if you're the one having heart surgery, it's the biggest event in your entire life and the biggest event for your family. So how do we do that thoughtfully and with compassion, and with sense, knowing that it's a big decision. But it could be right. That's on the extreme end of the gravity of it. It could be HR issues are popping up, right? I get a call from a physician about a serious HR complaint that comes up in the office, or we have a patient who's really disgruntled about an experience they just had. What should we do about it? And everything under the sun. I get a lot of calls from people who throughout the day who just, again, things are popping up that they need help with or that they want to advance. And I won't bore you with the minutia, but for me at that point, that is a lot of what my day looks like. Now, for previous roles, earlier in my career, it was a lot of what I started to describe earlier. I had a portfolio of projects that I would be working on and the purpose of those projects were so varied, whether they were logistical ones, big construction projects within the hospital. We want to start a new program. In my career, I've been very involved in starting a heart transplant program. I've been very involved in starting, we started our own helicopter air transport program for sick patients who need to be transported by helicopter. It's hard not being in it today, I think maybe for you all to understand how much intricacy there is to actually getting stuff like that going, but it's so involved. So much of my job today, but much more so even in the past, was being the person who's just constantly bird dogging those things to make sure that they're getting done. And then when there's stuff that has to go on around it, buying equipment, doing business plans and financial analyses to assess whether or not this makes sense, putting together presentations such that the senior leaders responsible for these things can present those topics to people and get them approved. I was the sort of person really driving a lot of that and doing a lot of the work. And today, as a sort of senior leader in the organization in these areas, it's a lot more about sort of helping the people on my team who are doing that work get those things over the goal line and get them advanced. And then also making sure, focusing their efforts and making sure that what they're working on is in line with what sort of me and my physician partners need to advance. So my day starts very early, which brings me to one of the quality of life things. You need to, as you think about what medical specialty you want to get into or whatever it is you want to do with your life, you got to consider sort of just literally how you want your day to work. For surgeons, it starts very early and ends very late. And I've really enjoyed that. I wasn't a morning person, but I've become a morning person. So my alarm probably goes off around 5 o'clock in the morning, which is very early, very late by cardiac surgery standards. But I eventually get to the hospital by about 6:30 or 7. And, right away, again, start with those meetings and those discussions and looking to push things forward. A lot goes on throughout the day. Some of it's scheduled, a lot of it's unplanned. And then, those meetings often continue in the evenings because the people who I need to meet with are busy taking care of patients all day, which is where we want them.
That was an amazing answer. Thank you so much for that. Again, a lot of really great questions. Do you want to keep going with your program, and then we can just save some time at the end for the others that are coming through?
Yeah, definitely. I'll look to leave. It's about 9:30. I'll look to leave maybe like 15, 20 minutes for questions if you think, based on how many we're getting, if that would be appropriate.
Sounds great.
So I started to just touch on some of this, so forgive me if a little bit of it ends up being redundant, but so let me just talk about my first many jobs. So my first position, so I eventually worked for the health system as a paid EMT. So I talked about how I did that as a volunteer. While I was still figuring out precisely what I wanted to do, I did that for paid, and it was helpful while I was still in school to earn a few bucks and again, being involved in public service. But I also knew ultimately being in a place like Northwell was where I wanted to be, and I thought working there in any capacity was going to be helpful to that endeavor. So I did that as an EMT. It was very incredible experience. I spent half of my time working in the New York City EMS system. Northwell, we used to call ourselves North Shore LIJ, was a sort of a contracted provider to the city system. So I worked in a couple of neighborhoods in Western Queens, sometimes in Manhattan, taking care of 911 calls in people's apartments and in stores and in the subways. It was crazy, and I could talk for 5 hours about that. And then I spent the other half of my time transporting sick patients between Northwell facilities. So if you show up to a community hospital at Northwell today, and in that hospital we don't do neurosurgery, or we don't put stents to open clogged arteries, or we don't do emergency open heart surgery, but you're really sick and you need to get moved quickly, we have our own EMS system. And that's what I used to do. So you would drive lights and sirens as fast as you can to that hospital. You would, as quickly as you can, get the patient packaged up, throw them on a stretcher, and get them back to the larger kind of tertiary hospital, we call it, where we do those higher end services. And it was amazing because I got to learn, just boots on the ground, the healthcare system, what patients experience. I got to learn how our ERs function really well, and some of our ICUs, and I got to work really close with the doctors and the nurses. And I still, see a lot of those people around the hospitals today. And some of my closest relationships are people I met at that point. But then I went into the administrative world. And for my first couple of jobs, I really spent time being a generalist, which, again, for me, I keep using that word, was really valuable, because virtually knowing nothing except for what my internship experience was, I really knew nothing about healthcare administration. So being able to learn a lot about a lot, working as a generalist in one of our hospital administrative corridors, was incredible. I worked with the CEO, the COO, the chief medical officer, the person who is the head of quality, the chief nursing officer, the person who heads up patient experience. And in that role, I was a support to them. I was a staffer, and my job was to just really take as much off their plate as I possibly could, and again, help them advance the mission. But working closely with each one of those people, I started to really understand the healthcare system, how a place like Northwell works, how it's set up, what goes on at an integrated healthcare system. What do you need to do to get things done? Because ultimately that's all what we're trying to do. But I was able to, again, continue to have experiences that helped me shape what I enjoyed and what I didn't. Everything down to, like, do I like sitting at a computer? Do I not like sitting at a computer? Do I like talking to people all day? Am I more introverted and I don't want to talk to people all day? Do I love working with numbers? Do I hate working with numbers? Do I want to be close to patient care? Maybe not. For some people, you go anywhere near patients and you get, even though you love the mission, you get queasy and you're like, all right, well, whatever it is, I don't want to go above the first floor of the hospital because I don't enjoy it. It's depressing to me, whatever. That ended up not being my situation, but those are all things you want to start to figure out. So again, in those roles, I did everything. I did a lot of number crunching because, again, I told you in the beginning, we're a big business, and a lot of the decisions we try to make should be evidence-based, it should be data-driven, and there should be empirical support for what we're trying to do. So I spent a ton of time in Microsoft Excel crunching numbers, but behind those numbers is healthcare, and I was able to really learn about how we're set up. I did a lot of project management. Again, I mentioned taking things off people's plate, and I still do that today. It was, what we want to do is build this program. We know nothing about it. We don't know what it's going to cost. We don't know what kind of equipment we need. We don't know what kind of medical specialists we need to do it. But hey, we know we don't do it today, and we know we should probably do it tomorrow. Run off and make it happen and report back to me every couple of weeks about it. So, I gave you two examples of some of the sexier projects, which was right, the heart transplant program, the helicopter program, turning some of our non-trauma center hospitals into trauma centers. That was really cool, but a lot of it was far more basic, but it was nevertheless equally rewarding. If we're going to do construction on an entire ICU that's occupied with patients today, how do you actually do that, right? It's not like a hotel. We can't just really, with hospitals that run over 100% capacity, we can't just say, all right, we're not going to take patients for a couple of weeks so that we could do construction. So you got to get creative about how do you do it, and how do you do it without disrupting patient care. Marketing, right? How do we advertise ourselves? How do we get ourselves out there? How do you work with the clinicians to understand what it is we should be marketing and advertising? I could go on and on and on, but my first several roles were about being a generalist and about really project managing various initiatives. But for many people that might look different. And again, you might be more focused. You might work in our corporate finance division as an accountant and doing financial reporting, which is hugely important. You might work in business development, helping to identify physician prospects and doing business plans and helping to get them contracts. You might work in our strategic planning division. You might work in HR and human resources. It goes on and on and on, and I'm not going to be able to cover all of it, but that was the beginning for me. And then eventually I moved into specific departments or service lines. And for a couple of years, I was at one of our hospitals as the department administrator for the emergency room, which was an incredible experience and really tied together my EMS background with the hospital. And in addition to managing the emergency room and the Department of Emergency Medicine, I also managed the hospital's trauma center and was the administrator for the hospital's trauma center, again, working with a nursing leader and a physician leader. And that was an incredible experience. And again, in that role, I started to be a business owner. I sort of owned all aspects of the program: finance and growth, quality, patient experience, people management, and so on and so forth. And I did that up until about 4.5. Oh, and then right after that, then I also oversaw the Department of General Surgery in that same hospital. So kind of ended up taking more and more. And I think that's been another thing in my career that I've looked to do is, as I grow professionally, I've looked to expand my scope and constantly be challenging myself. And what I'll say is that, just another kind of little pearl for your career is, I think all along the way, you're going to encounter things that make you uncomfortable. And I think that's good and that's healthy, and you should embrace that. I think in every step of your life and your career, if you're not doing something that makes you a little bit uncomfortable, you're not quite pushing yourself enough, and you're not aiming high enough. And I think that should be in everything you do in your life, whether it's professional or really personal. I think challenge yourself, make yourself feel a little bit uncomfortable. I think that's really how you grow. And then 4.5 years ago, I became the service line administrator for cardiac surgery and thoracic surgery here at Northwell. And that's a lot of what I described to you throughout this entire talk of what I do today. And I hope you get a clear sense of it. And then this past November, for me, that role expanded to be what it is today, which is the service line administrator at Northwell for cardiac surgery, thoracic surgery, and then for all of cardiology here at Northwell Health. So that was my path. And then I think the last thing I had on my list is really what I love about what I do and what motivates me. But I think I ended up really covering that throughout this entire thing. So with that, I think I'll pause. I'm sure I'll end up covering a lot more throughout the questions, but I do want to, in advance, and I'll just again just thank you again for participating, not just in my discussion today, but in this entire program. And I want to thank Rebecca and Dr. Langer and Dr. D'Amico and everyone else from Lenox Hill and from the Department of Neurosurgery who's involved in starting this. I think an important, as I've told you throughout my discussion today, I have benefited immensely from people sharing their careers and their perspectives and their lives with me. And I think it's really important to surround yourself with people like that who are willing to do that. And the fact that in this case, the Department of Neurosurgery at Lenox is so passionate about internships and about sharing their wisdom with younger people, that speaks to who they are. And you should stay close to people like that. And you'll see throughout your entire career, and this is another thing I should have included in my talk, you need mentors, and you need sponsors, and you need coaches, and you need people who can offer their insight and who can guide you along the way and who you can bounce things off of. And I would be literally nowhere without the people who have done that for me. And I think it's incumbent for everyone that as you then have those experiences to pay it forward and pass it along, which is why I think as soon as Rebecca mentioned doing this for me, I was like, absolutely. I'm very involved in our administrative summer internship program that we typically run, as well as one of our sort of management programs that we run for people just coming out of college. I'm passionate about it. I think it's hugely important. And I think not only is it about paying it forward, but it behooves us. I hope all of you become really successful people at what you do. And I hope you choose one day to bring those successes here to Northwell Health. And that's another selfish reason why we participate in stuff like this. So again, I want to thank Rebecca and Josh and Dr. D'Amico and Dr. Langer and everyone for putting this program together. And I want to thank you all for participating.
Awesome. Thank you so much. This is fantastic. And I think that everyone can see, the success that David has had, and just by hearing him talk over the last 40 minutes, the reasons why, and just that really solid work ethic, but also that humility and that desire to keep learning and growing is so important for all of us, no matter where you are in your career. There have been a ton of great questions that have come through. Please do keep sending them. But David, just to start off, I think there have been a few questions about just the relationship that you have with the physicians, and how do you interact with them? Are they bringing you ideas? How are you being responsive and implementing those ideas?
Yeah, definitely. So what I really love most about my job and the specific role I do within Northwell is being able to work with the physicians so closely every single day. They are remarkably smart and hardworking people. And it's humbling to be around that. You feel like you have imposter syndrome sometimes. I'm like, to get the amount of time with them that I do and to be such an important partner to them is really, I love it. So what is my time like, and the sort of things we spend a lot of time together. And as I mentioned, my job is to take from them their feedback, their direction, their understanding of what's going on at Northwell, and using that to advance our mission. Because they are the front lines, because they are the experts, they know the right things to do. And it's my job to finesse it and to get it done and to provide some guidance and some guardrails, right? Out of the box, they might not be perfect ideas, but they are absolutely the right idea. And then it's about working with them to make it perfect. That involves really taking the time to not only sit down with them in meetings, but I have spent a lot of time throughout my career, particularly as I started new jobs, with going into the clinical environment with them, seeing it their way, understanding how the service is set up, understanding how they deliver care, whether that's in their offices, in the operating room, in the ICU. And I think any good hospital administrator, healthcare administrator takes the time to do that and understand it. Because if you don't really know how things work, and if you don't come to understand how it works, you can't be as effective. So I think spend a lot of time doing that. And then I spend a lot of time understanding their perspective, understanding where they want to bring things, and then working tirelessly to getting it done. And I think a huge measure of success for me is how much I'm able to take that and effectuate it. And it's all about the follow through. It's about getting things done. And I think I pride myself on bird dogging those things that the physicians and I collectively sort of identify together. Does that answer the question, Rebecca, you think?
Yes, that was great. And I think in a follow-up to that, for some of the future physicians, in this discussion right now, is there any advice from an administrative perspective of skills that you think that they could build, or degrees that physicians can obtain to, maybe move into a future administrative career, or just be administratively savvy as they come up as a physician?
Yeah, definitely. So I think it's about more than anything, it's about the experiences. So we have a few medical students from our School of Medicine who, as med students, are proactively seeking out administrative experiences. And I think many medical schools have set up formal things, formal channels for that, whether they're sort of like little residencies or something to do over the summer, almost like administrative internships. But even when there's not, I think seek out opportunities to get those experiences. If you're a medical student at whatever place across the country and you're spending time in a specific department and you come across the administrative person in that department, spend time, even as simple as get a cup of coffee with them and use it as an opportunity to understand what they do and another perspective, sort of like you've gotten from Rebecca and me and others, and spend time doing that. In terms of, and then also take the time outside of anything to just stay abreast of what is going on in the healthcare landscape, from a policy standpoint and from a general sort of landscape, and wherever you live. If you live in New York, what's going on in New York healthcare? What hospitals are doing what healthcare systems are doing what's Amazon starting to do in the healthcare space? What's CVS starting to do in the healthcare space? And there's a lot of various journals and online places where you can get that information. And then I think if you're interested in becoming a physician, and once you've gone to medical school and maybe you're in residency, and once you've really gotten your roots settled in that, and I think that's once you're past you're in residency, you're in practice, and you're interested in doing that, I think it's about seeking out opportunities, participate in committees within the departments and within the hospitals, asked to be responsible for specific tasks, right? Be the person in the department who's going to go to the credentialing committee, be the person who's going to be responsible for billing performance within the department, be the person who's going to work on research. It goes on and on and on. And I think, I'll add another lesson. Don't always be infatuated with title and money and things that come along with responsibilities. Seek out those experiences and the ability to get involved with things, and I think it'll pay dividends. And then, should you become really interested, I think advanced degrees make a ton of sense. And in the healthcare space, that could be an MBA with a concentration in healthcare. That could be an MPA, which is a master's in public administration, which is the degree that I got, which was a focus in health policy and management. It could be a MHA, which is a master's in hospital administration. It could be an MPH, which is a master's in public health. I think many of those, it depends a little bit in terms of what you want to do, but I think even outside of very specific things that you want to do, I think you get very similar elements from most of those programs. I think you'll usually get the foundational exposure to healthcare finance, healthcare economics, management and leadership, the reimbursement paradigm, and some other things, irrespective of which one of those programs you go to. Because I often get questions from people about sort of what sort of advanced degree should they pursue.
Fantastic. Yeah, great question from Claire. Claire's asking, this may be a weird question, but how do you ask senior administrators for coffee? And I understand that perspective of, senior executives will often say reach out, but it's a little bit intimidating for someone fairly junior in their career to really approach an administrator. So, what ways have been effective that people have tried to connect with you and you've been responsive to?
Yeah, I think I've been spoiled in my career here at Northwell, because I think it's so a part of our culture that it's reasonable for anyone to, if you want to spend 30 minutes with someone picking their brain about career stuff and just about life in general, it's so part of the culture here that it's easy to do. But recognizing that sometimes it's uncomfortable, I would say it a few ways. I think reach out pretty formally first over an email. I think explain, ask someone, hey, may I have your contact information? If you see someone and say, I'd love to send you an email one day, just to kind of, ask you a few things. Everyone's going to be willing to do that. I think you send an email saying, remind them of who you are and where you met, and say, I'd love to come to your office one day and just meet with you for a few minutes, or would love to do it over a cup of coffee. I'm so interested in what you do. I'm so interested in X, Y, and Z. And it would just be incredible if one day, if I could pick your brain for a little bit, if you're open to it. And I think over email makes it a little bit easier. If they don't want to do it, they won't answer you. It's not that hard to deal with that. I think you'll find that most of the time they'll be very happy to do it. And then in some instances, what they might do is just redirect you to somebody else. But I think no matter what, that's so part of what goes on in the healthcare environment. I mean, we're just set up that way, right? We have students and we have residents and we have fellows. It's just teaching is so part of the culture that I think you'll find most people are pretty willing to engage with you on that front. And then ask around, right? If you're a medical student in a department, ask ask one of the attendings who you've gotten to know a little bit, or one of the residents, hey, I would love to get together with an administrative person just because I want to understand that. Like, do you think you can make a connection for me? You got to use your network. And that's why it's so important to build a network. Never let a single conversation you have with someone go to waste, right? You grab a speaker for a few minutes after they give a grand rounds talk, or, I will be sure to pass along my email to you all through Rebecca, and reach out if you want to talk. And I think, whatever those experiences are, you meet someone at a happy hour, keep building your network of people, because invariably you or someone you care about is going to want to speak to someone like people you've met along the way. And I think that's really important.
Rebecca got disconnected, so I'll feed you a question she wanted me to ask you.
Sure.
She's back now. But she said talk about the landscape and the competition in NYC and how you think it affects Northwell, and if you think it's a good thing for Northwell.
Yeah, so great question. I'm just going to write it down so I get two elements of it. So just write the landscape in New York City and then kind of how it affects Northwell. So we're incredibly well positioned, and that is in thanks entirely to the senior leadership of this organization, Michael Dowling, who's our chief executive, Mark Salazzo, who's our chief operating officer, Dr. Smith, who's the dean of our medical school and our physician in chief, and the list goes on and on and on. So I'm not going to name every last person, but we've had a consistent leadership for many years, and we've had incredible chairmen in the departments, and we've had a consistent vision. And despite for many years not having the name that many of our competitors have in this market, we've been, I think, ahead of the curve in several things we've done, chiefly building our network. And what I mean by that is we have spent years acquiring hospitals, and that's why we're the largest healthcare system in New York. We have 23 hospitals. We have spent years building our ambulatory network, our doctors' offices, our urgent care centers, our ambulatory surgery centers. And at this point, we have over 750 of them. And all of our competition is really trying to do the same thing at this point. And they were a little bit late to the game in that sense. And granted, they've made great strides in many other areas. So it's not entirely a criticism, but it's to say that we've been really set up competitively well in this market. So you really have, I think, a couple of big players here. You have Northwell Health, you have Mount Sinai, you have NYU, you have Cornell and Columbia, to a lesser degree on Long Island, you have the Catholic Health System. But really all of us, everyone has their specialization, but we're all ultimately trying to do many of the same things. We all have big cardiac programs, we have neurosurgical programs, we have general surgery programs, orthopedics, and it's a fierce market. You turn on the radio, you turn on the news any night, you're going to see commercials, you're going to see us all fighting for the same type of procedures or the same conditions. And many times we're competing to acquire the same physicians or the same practices. So, but really it's about just continuously sort of, pushing ourselves forward. And how it's affected us is, I think it's driven us to get to where we are today. I think we've always been really hungry. We haven't always been able to rest on the name, and we've had to be really innovative, and we have had to be scrappy, and we've had to be aggressive. And I think it's paid dividends.
Hey, David, it's Randy D'Amico again. How you doing?
Hey.
I mean, fantastic talk, obviously. I like to chime in sometimes at the end. I think that the growth of Northwell is so absolutely impressive. I mean, based on just the U.S. health news reports that came out this week, I mean, talking about a relatively new hospital system in a place where you've got 5 major academic centers in a 14-mile by 2-mile radius, all of which have been here for about 100 years or so.
Yep.
And, our numbers just climbed. I mean, it's just neurosurgery in general. We're in the top 50 in all 3 programs, throughout New York City and Long Island. And I think that's incredible. It's a true testament to excellent leadership, both within the department and above. And I mean, I think you guys are doing something right. We're talking about in 8 to 10 years, we've grown and jumped to the forefront and are constantly climbing. So huge congratulations for that. From that end of things. What do you think about, one thing I always find interesting is capturing, you said you have 750 independent practices or whatever, smaller practices, how do we capture those patients as well to bring them in and stay within the network and system? Are there ways, are there mechanisms in action to kind of promote kind of Northwell, referrals and capture?
Yeah, it's a great question, and it's obviously probably top of mind for most of the senior leaders in the organization. And just for everyone on the call, what Dr. D'Amico is referring to is, think of healthcare like a big pyramid, and on the bottom and the foundation, you have primary care, right? You have people who are going to their internists, you have people who are going to urgent care centers, and they over time are being referred to medical subspecialists, things like cardiologists and pulmonologists and gastroenterologists. Then they're being referred to specialists, whether that's surgeons across the various fields or very niche medical professionals. Then eventually they need to go to the hospital and they need to have those things done, ultimately funneling up into like the sort of the rarest and the smallest piece of what we do, but some of the things that are most prominent. And the point of us building our ambulatory network has been to widen that funnel. You want to catch as many patients as you can, and you want them to be referred within your network. It doesn't do us a whole lot of good if, as an example, we have a very busy primary care physician, but every time they need to send someone to another specialist, they don't send that person to a Northwell specialist, because then presumably when that person eventually needs to go to the hospital, they might not come to Northwell. So it's all about us building this funnel. So Dr. D'Amico's question about what do we do to preserve that? I'll go through a few things, but I'll also, with the caveat that we need to do better. And one of the things I spend a lot of time on is figuring out how to work on that piece of it. First and foremost, it's really important to drive awareness. We are such a big organization, and we have so many new people coming in all the time that it's very easy for you to not know who we have and what they do and the depth of what they do. Within our neurosurgical department, not only do we have neurosurgeons, which of course I think is well understood at this point, but we have specific people who do incredibly niche things, right? They're thought leaders in the country who do something very specific. But if you're a neurologist or a primary care doctor or an ER doctor, and I'm making some of that up in this organization, and you got here 6 months ago, you might have no idea. And you might have trained at a place where they have this expert. So you're going to say, I'm going to send you down the road to this place because they have the person. So first and foremost is really driving awareness. Secondly, a lot of it's about access and convenience for patients and for the referring providers. So we need to make sure that within a market, we have the right mix of people. And what I mean by that is, it's not gonna, if you need a gastroenterologist in Riverhead, which is all the way out on Eastern Long Island, it's not gonna do us a lot of good if we have no one out there, but we have 10 of them in Westchester. So it's about making sure that you have the right availability of people and that they're in the right places, and then that they know that each other exists. But then within that, frankly, you need to provide a really great product, because ultimately you could put as much pressure as you want on the people to refer within the network. If the people who you're referring your patients to aren't doing a great job, and if your patients aren't doing well in terms of their outcomes and aren't having a good experience, you're dead. I mean, they're gonna refer elsewhere. Then when you get to the next level, then you start to get into operational things which is what we're working on, about how do you make it truly seamless, right? How do you make it so the patient can walk out of their appointment with you with an appointment with the subspecialist to whom you're referring them? And how do you make sure the access is good? And we spend a lot of time, if you just got told that you have a brain tumor and you need to see a neurosurgeon, you're not waiting 3 months for that. And the person who's going to be the good person who's going to be able to see you very quickly is the person who you're going to have a lot of confidence in and who you're going to stick with. So we spend a lot of time around that, but it really boils down to the 3 A's that often get thrown around, which is really accessibility, which we talked about. It's affability, and you need to create a good experience, and you need to be sort of likable, and you need to look at the patients as your customers, but also the referring providers. And then it's also about ability, being able to really do a good job. And we're constantly working on this. We do a reasonably good job around that network integrity piece, but we could do better.
I got to tell you, I mean, after I've worked in a few places, and I think the Northwell atmosphere, the environment is incredible. I think people enjoy working there. I think everyone's motivated to create a likable environment that cares about its workers, right? And from worker happiness will come patient happiness. And it's absolutely commendable. I enjoy every minute that I'm there. So it's truly, truly great. I do, you know, someone just asked about what the pandemic taught about the administration. We don't have a lot of time.
I'm sorry, you broke up a little. So I heard we don't have a lot of time was the last thing I heard.
I do think that there's a corollary to that question. Did I cut out?
Yes.
We hear you now.
Yeah, sorry. My not that good at Wi-Fi.
We're all having Wi-Fi issues today.
Yeah, I think the pandemic did help in a way because we've embraced telemedicine and the tech has advanced so rapidly and so quickly. And for exactly what you said, you know, someone with a brain tumor doesn't want to wait a few months to see a doctor. And so via telemedicine, I can see that patient that night in the comfort of their own home. You establish a relationship and you get to tell people immediately, you know, the access to that they're going to have to specialists who can handle these things. And so I think we're on a very important horizon here, looking forward with this stuff. And it's going to be fantastic as long as we embrace it and kind of jump on it and make those communications happen with the referring providers and people in the community as well. So
Definitely. Yeah. And just on to that end and also COVID in general. Yeah, we administrators, physicians, nurses, everyone in the healthcare environment, you know, COVID was and is terrible and clearly one of the worst things this planet has seen in many, many years. But I will say we've spent a lot of time thinking about how to emerge stronger, how to emerge better. There's an old saying that goes, you know, you don't let a good crisis go to waste. And, you know, this has been horrible and we're recovering from it, and as is the whole country. But we could kind of sit here and just sort of recover and go with the flow, or we could think about how do we really try and generate some positivity from this. And telehealth was a perfect example, something that really should have been more mainstreamed years ago. We in general, the U.S. healthcare system has been slow to embrace, and COVID catapulted it.
yeah, absolutely. It's fantastic. All right. I think we're out of time. Any last thoughts?
No, other than, you know, once again, I just want to underscore, again, you know, my thanks to everyone at Lenox Hill and in the Department of Neurosurgery who's involved in starting this program. Incredibly impressive. I want to thank the participants. I think keep doing stuff like this. Rebecca, I want to make sure, you know, if there's important questions that we didn't get to, you know, you and I, let's find time in the next few days. We could put together a little FAQ and make sure those questions get answered. I'll be sure to send out my email. Please don't be shy about reaching out, and good luck with everything you all do. And, you know, if we can ever be helpful, just let us know.
Thank you so much for being here and being a part of this. You've been fantastic, and we will definitely regroup to make sure the questions are answered and that we get David's contact information out to everyone. So thank you.
Thank you for having me. Enjoy the rest of the summer, everybody.
Thank you.